Easiest method to localize stroke for your exams. We divide the stroke localization into middle cerebral artery strokes or MCA circulation strokes. Number 2, anterior circulation strokes, ACS strokes. Number 3 is posterior circulation or PCS strokes. Then we have got special category like the Pica of middle cerebral artery, as there is a motor weakness and then there is a sensory loss, wherein the patient presents to you with opposite limb involvement, aphasia and neglect. Aphasia is a feature that is seen in involvement of dominant hemisphere, whereas neglect is a feature of non-dominant hemisphere. So remember the mnemonic MCA: motor and sensory loss, contralateral deficits, aphasia and neglect. The patient usually presents to you with contralateral face along with arm weakness. Patient is presented to your clinic with involvement of the face and involvement of arm. Patient also has got sensory loss in the same pattern, and patient has aphasia or hemi-neglect of that particular site. Anterior circulation strokes presents to you typically with leg weakness along with loss of control of urine, that is urinary incontinence. So lower limb involved more than upper limb points towards anterior circulation stroke, whereas upper limb involvement more than lower limb points towards the middle cerebral circulation stroke. Along with abulia, there is lack of motivation. So here again we have got a mnemonic ACA, stands for anterior cerebral artery, also stands for ankle weakness, control of urination is lost, and abulia. Along with this, we also see behavioral changes because of involvement of the frontal lobe. Posterior circulation is rarely asked. Here usually patient presents to you with involvement of visual cortex, so patient cannot see. So patient has presented with blindness. And also this is associated with contralateral homonymous hemianopia. Contralateral homonymous hemianopia along with alexia without agraphia. So patient is able to write, but patient is unable to read it out. This is involvement of dominant hemisphere. So these three things point towards the PCA stroke, that is a posterior cerebral artery stroke. Patient presents to you with cortical blindness. Bilateral PCA stroke is seen in Anton syndrome. The fourth category of stroke is Pica. Here the patient typically presents to you with involvement of ipsilateral face. Remember, contralateral face was involved in middle cerebral artery, whereas Pica, that is posterior inferior cerebellar artery stroke, presents to you with ipsilateral face, so face inferior, then involvement of contralateral half of the body, that is crossed hemiplegia, and then patient will have pain as well as temperature loss. Next we talk about the characteristic presentation of Pica. Patient presents to with Horner syndrome, that is ptosis, meiosis, anhidrosis, and loss of ciliospinal reflex. Then patient also has got dysphagia because of involvement of the 12th cranial nerve. Patient has got hoarseness because of involvement of the 10th cranial nerve. Patient has got vertigo and nystagmus because of involvement of the cerebellar tracts. This syndrome is also termed as lateral medullary syndrome or Wallenberg syndrome. Remember, Wallenberg syndrome has been multiple times asked in exams. How does Wallenberg patient presents to you? Patient usually presents with the ipsilateral face, contralateral body, and signs of bulbar palsy, that is hoarseness of voice, dysphagia, vertigo, nystagmus, ataxia. Patient has got sensory involvement of ipsilateral face and crossed deficit. This is the key feature of Wallenberg syndrome. The last one in stroke localization for your exam is medial medullary syndrome. The medial medullary syndrome, involvement of medial lemniscus is seen, hence the patient presents to you with contralateral loss of vibration and proprioception because of involvement of the dorsal column tracts or the posterior tracts. Patient presents to you with ipsilateral deviation of tongue. Then also the patient presents to you with involvement of the corticospinal tract resulting in contralateral hemiparesis. It's not plegia, it's paresis. This is also important. So here the artery involved is the anterior spinal artery. Radiological significance in stroke localization is as follows. We have got various radiological images pointing towards middle cerebral artery. This is the anterior circulation stroke, whereas this part shows the posterior circulation stroke.